Good day. My name is Chris Winder, Director of Client Services for ThinkDocs. ThinkDocs is an information management consulting firm and Laserfiche reseller. Today I want to provide you some insight and information on how to prepare for mobile information in the hospital setting. And really what we're going to go through is some of our information, some of the data that we've collected on what hospital needs and how that translates into a platform for mobile. First of all, we have to start off by acknowledging that there are multiple users and stakeholders that have important views on what should be involved with a mobile application and mobile information use in a hospital setting. From the hospital's perspective, they need to know who's been accessing information. They need to know that they can protect certain information from being accessed on a mobile platform. And lastly, it's going to have to tie into multiple existing systems. On the other side of the ledger, we have three major use groups. The doctors, who are going to be involved with care, the other parts of the care team, the nurses, and lastly, at some level, the administrative users, whether this is the transcription people or whether this is finance or the compliance team, will need some level of mobile access. How much mobile access we have is where we have to make interesting decisions. And part of those interesting decisions are really going to be based on how well we can meet the requirements for each one of these user groups. On the left-hand side here, we have the hospital requirements, which is identity and access management, easy to use connectors and APIs so that we can tie into those existing systems, so that we can tie into the existing Active Directory. Case management, which is going to give us some of that granular control on who's assigned to cases and how do we alter the next steps when we run into trouble. And again, that's tied into the security aware workflow, which is really around case management. And lastly, we need to have a mobile app that is built and tied directly to the information presentation system, whether that's an ECM or an EMR or some other system. It needs to be tied directly so that we can take advantage of the mobile responses. On the other side, we have, for the doctors, nurses, and administrators, we really have a singular set of requirements. Firstly, it has to have on-device data encryption. That's partially for the hospital side, but that's also to protect the doctors and nurses and administrators who are using the system. It has to have customizable information capture UI. This could be through a forms-based view where you have checkboxes and touch boxes. It has to have mobile email integration. So much of the systems that we use are tied to our email, whether we're talking about calendaring or whether we're talking about lab reports. These are all tied into email, so we have to be able to access those documents when we're on the road or when we're using the mobile application. We need the integrated signature and approval process. We want this to be single button, whether this is an approve button or a signed button. All three groups are going to need to sign documents, and if we have this available in mobile, it's more likely that they'll use our platform rather than going elsewhere. Full access to information based on user permissions. Obviously, if you are a doctor, you're going to have different permissions than a nurse or an administrator, and all that needs to be available within the mobile application. So one of the ideas that we have here at ThinkDocs is, and this really goes into the how of we do it, we think that when we start talking about all these requirements, there's three major things that we need to be able to take care of as we're building out what that mobile look looks like. One is a forms-based capture. This allows us to take advantage of touch. This also allows us to present information in a responsive manner that matches the size of screen that the user has, irrelevant if it's a tablet or if it's a mobile phone. And lastly, the care team should be automatically added to the patient file. If we've met all the requirements on the left-hand side, that should be easy enough to do. We should be able to pull that from existing systems, whether it's EMR or whether that is one of our HR systems that's related to the clinical team. And lastly, I just want to thank you for watching this. This was just a short presentation on the potential of mobile and the potential of how we can use existing resources to get to mobile. Thank you. Please visit our website for more information or contact us directly at chrisw@thinkdocs.com.